In this brief video, Dr. Salaam, board-certified physician and co-founder of Memphis Center for Aesthetic Medicine in Germantown, Tennessee, explains microneedling. What is microneedling?
Yes. Microneedling, also known as collagen induction therapy, is a non-surgical, minimally invasive skin rejuvenation technique. And this procedure utilizes a motorized and medical grade device that helps to stimulate the proliferation of new skin cells. And it also facilitates the breakdown of scar tissue. And the formation of this new healthy tissue helps to support collagen and elastin, and as well as new capillaries. And it allows providers to deliver moisture and nutrients to the deeper levels of the skin. And when we do this, the skin appears more youthful, it appears more healthy and more attractive.
How can microneedling help rejuvenate the skin?
The microneedling procedure creates microchannels in the skin. Now, these microchannels, they seal within a few minutes of completion of the treatment. And what happens, the body senses it as a micro injury to the skin, and the body starts releasing its own growth factors and stem cells. And these growth factors and stem cells can then repair tissue in the deeper levels of the skin. And when it repairs this tissue that is unseen by the naked eye, the skin becomes more healthy and more glowing, and the texture of the skin changes.
What skin problems can microneedling address?
Yes. Microneedling is excellent for the treatment of acne scarring, poor skin texture, dark marks or hyperpigmentation, if you have thinning hair or alopecia. Also, it can be used for skin laxity, and it can also be used to improve pore size on the skin.
Am I a good candidate, or who is a good candidate for microneedling procedure?
Okay. Microneedling is great for patients that are suffering from acne scarring, for patients that are suffering from thinning hair or alopecia, also patients that have stretch marks, or patients that want to refine large pores, or if you have poor texture of the skin as a result of acne scarring. And also, microneedling is great for patients that suffer from dark marks or hyperpigmentation.
How many sessions are required for microneedling treatment?
For best skin rejuvenation, the microneedling procedure is best done in a series of either 3 to 6 treatments, depending on the results we're expecting in a patient. It can also be done seasonally. So when you are evaluated by your provider will look at the nature and the extent of the problem and develop a customized regimen for you. But generally speaking, a series of at least 3 to 6 treatments will improve the results of the skin, and will help to rejuvenate the skin.
Are there any patients who you would not recommend in doing this procedure?
There are certain patients that are not good candidates for the microneedling procedure. And those patients are pregnant women or breastfeeding women, patients that are suffering from cold sores or open wounds, or any other medical skin condition in the treatment area. Also, patients who have taken Accutane within the last 3 months would not be a great candidate for the microneedling procedure. And lastly, patients who have received radiation therapy within the past 12 months of the procedure. These patients would not be a great candidate for the microneedling procedure.
Is microneedling safe for skin of color?
Microneedling is a safe, minimally invasive technique that is appropriate for all skin types and all skin colors.